macrolides may modulate the lung and systemic inflammatory response. On the other hand, beta-lactam when used alone may increase the systemic inflammatory response. If there is a risk of pseudomonas in your patient, then you have to select 2 anti-pseudomonal antibiotics, and the most important drugs in this group would be a beta-lactam, which is in the form of cefepime, a third to fourth generation cephalosporin, or imipenem or meropenem along with piperacillin tazobactam. One of these drugs can be taken and it can be combined with the anti-pseudomonal quinolone in the form of ciprofloxacin. If along with this there is a risk of resistant staph infection, then you can add vancomycin or linidazole. So this is the different combination of antibiotics which you have to use. Along with this, it is very important to treat this patient very aggressively, because most of these patients may come in hypotension, shock, they may have multiple organ dysfunction. This patient needs to be fluid resuscitated very aggressively in the form of early goal-directed therapy. They may require immunomodulatory drugs in the form of activated protein C. In selected cases, those who are received fluids and are on vasopressors may require a short course of low-dose corticosteroids. The glucose control is also important, although there has been a lot of controversy in this. Recently now there are reports that very aggressive glucose control can lead to increased mortality due to hypoglycemia. Then of course choosing the optimal low tidal volume ventilatory strategies. So these are the all very important components of management in these patients, which helps in improving the outcome of these patients. So antibiotics alone may not be that effective unless you treat this patient very effectively. Despite this kind of management, there are some patients who may fail to show good response, adequate response, or expected response. In these cases, you may have to look for certain factors like the inadequate antimicrobial drugs which we have chosen, maybe due to the development of resistance to various common bacteria, or it can be because of unusual pathogens. The patient may be having significant non-infectious processes in the form of congestive heart failure, pulmonary embolus, or other complicating factors which may interfere with the resolution of the disease. The another important factor in many cases of severe community-acquired pneumonias who are failing to respond is the presence of pleural complication, and this is particularly important in patients who have infection with gram-negative organisms. So these complication must be actively looked for, and if there is an evidence of empyema or pleural effusion, then one should aspirate it for diagnosis, and in case there is an evidence of empyema, one should do the therapeutic evacuation of the pus. So to conclude, severe community-acquired pneumonia remains an important cause of admission to medical ICUs. Early recognition of this form of pneumonia patients is very important. The early recognition of the severity of the disease and proper triage of these patients and placing them into the right place is the most important and the crucial issue in their management. The etiology of severe pneumonia is different from what we see from a simple pneumonia. The greater attention is required for the accurate diagnosis and use of non-standard antibiotics, aggressive resuscitation, and consideration of immunomodulatory therapy is important in selected patient with severe disease. Thank you very much.
Severe community acquired pneumonia, that was the topic of our second session of today's teleconferencing program, and Dr. J.C. Suri told us in detail about this particular topic. Thank you so much, Dr. Suri, for being with us in our studios and telling us all about this particular topic. And friends, we will be back in our third session from 3:30 onwards in the same teleconferencing program. Till then, keep watching teleconferencing program on your own Gyan Darshan channel.